Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
Clostridia, as a family, are obligate anaerobes, meaning oxygen is toxic to them. In their natural habitat, they thrive in deep, compact soil. When exposed to fresh, oxygenated air, they often experience stress and produce spores, which are metabolically inert and highly resilient to environmental conditions. Once conditions improve, these spores can germinate and develop into fully mature Clostridia. During a Gram stain, Clostridium botulinum appears purple, indicating it is Gram-positive. It is a bacillus, meaning it has a rod-shaped or cylindrical appearance under the microscope. Clostridium botulinum is infamous for producing botulinum toxin, a substance that causes the illness known as botulism. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. Historically, food preservation methods like sausage making and canning became widely used. However, because these methods create airless environments, a Clostridium botulinum spore introduced during food preparation can grow, producing botulinum toxin and contaminating the food. In fact, the name Clostridium botulinum comes from the Latin word botulus, meaning sausage. When the bacteria infect a can, it causes the can to bulge with gas as the bacteria metabolize sugars into short-chain fatty acids. These short-chain fatty acids, primarily made up of carbon dioxide and hydrogen, produce a gas that has an especially foul odor. Nerves that use the neurotransmitter acetylcholine are responsible for muscle control. When a contaminated food product is ingested, botulinum toxin binds specifically to these nerves, preventing muscle contraction. The toxin exists in 8 distinct types, named A, B, C, D, E, F, G, and H, each varying in toxicity. Once inside a neuron, the botulinum toxin is taken up by endocytosis, forming a small vesicle within the neuron's cytoplasm. The toxin then activates, escapes from the vesicle, and begins cleaving snare proteins. Snare proteins are crucial for pulling vesicles containing acetylcholine to the plasma membrane, where acetylcholine is released into the synapse to signal muscle contraction. Without snare proteins, acetylcholine cannot be released, leaving the affected nerves unable to send signals. This causes the muscles to become completely relaxed and flaccid. Muscle weakness typically starts in the muscles controlled by the 12 cranial nerves, those responsible for facial movements, eye movements, chewing, and swallowing. Additionally, nerves in the autonomic nervous system that depend on acetylcholine are also affected. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. In the early stages, botulism can lead to bulbar palsy, which impairs cranial nerves, and over time, it may progress to descending paralysis. Symptoms of botulism include double vision, drooping eyelids, difficulty making facial expressions, and trouble swallowing. Due to effects on the autonomic nervous system, it can also cause dry mouth, postural hypotension, low blood pressure when standing, nausea, vomiting, and constipation. In severe cases, the symptoms can advance to complete flaccid paralysis, which can be fatal if it affects the respiratory muscles. The diagnosis of botulism is primarily confirmed through serum analysis to detect the presence of botulinum toxin. Culturing Clostridium botulinum is rarely successful, as anaerobes are challenging to grow in laboratory conditions. Treatment for botulism is mainly supportive, with the primary goal being to assist the patient in maintaining proper breathing. In adults, passive immunization with an antitoxin is also an option for treatment. There are 2 types of antitoxins: a trivalent antitoxin that targets toxins A, B, and E, and a heptavalent antitoxin that covers toxins A, B, C, D, E, F, and G. The role of the antitoxin is to bind to free toxin molecules in the bloodstream, preventing them from damaging neuronal proteins. Most canning processes involve high-pressure cooking, similar to autoclaving, which effectively destroys the toxin and sterilizes the can's contents. Other preserved foods, such as pickles, are safeguarded by high acidity or low pH. The most common type of food-related botulism is infant botulism, also known as floppy baby syndrome. Newborns and infants have underdeveloped gut flora, making their intestines vulnerable to colonization by Clostridium botulinum. Once the bacteria colonize the gut, they continue producing toxins directly within the intestine, leading to botulism. Honey has been identified as a potential source of Clostridium botulinum spores and should be avoided in children under 12 months of age. Finally, two types of botulinum toxin, A and B, are less toxic and can reliably cause a long-lasting neuromuscular junction block. As a result, they are sometimes diluted and injected into rigid muscles to relax them. Botulinum toxin is also used to treat other conditions, such as hyperhidrosis, excessive sweating, achalasia, and focal dystonia, which is characterized by involuntary spasticity in a muscle group. Additionally, botulinum toxin is popularly used as Botox in aesthetic surgery to smooth out wrinkles for a few months. If you haven't already watched my videos on other species of bacillus, like Bacillus cereus and Bacillus anthracis, you're missing out. Here's a quick difference to get you intrigued. Bacillus cereus is infamous for causing food poisoning, especially in improperly stored food, while Bacillus anthracis is known for causing anthrax, a serious zoonotic disease. Make sure to check out my playlist on gram-positive bacteria for more detailed insights and related content. In summary, Clostridium botulinum is an obligate anaerobe that produces spores and secretes botulinum toxin, which causes botulism. These spores are commonly found in improperly preserved food and honey. Ingesting food contaminated with botulinum toxin can result in a neuromuscular block and flaccid paralysis, which can be fatal due to suffocation if not treated with supportive care. Thank you so much for watching. Don't forget to subscribe to my channel, press the bell icon button. Thank you!